We're talking about the fear of such horrific scene where a dog runs towards this young boy, attacks him, causing significant and severe lesions and wounds. But the real fear and the true severity is being infected with rabies, which almost always causes death within days to weeks. Fortunately, this disease, rabies, can be prevented, avoiding this risk of death. So in this video, we'll detail everything concerning rabies, what is rabies, its definition, its mechanism and pathophysiology, its symptoms, and finally its treatment and prevention. After a bite or lesion or wound from an attack by a rabid dog, the rabies virus of the genus Lyssavirus, found in the saliva, penetrates the organism, transmitting the infection. More rarely, the virus can enter through a brick in the skin or through the mucous membranes of the eyes, nose, or mouth. The rabies virus is neurotropic, so it travels from the inoculation point toward the spinal cord or toward the brainstem in case of a bite to the face, via the peripheral nerves, then toward the brain. It then spreads from the central nervous system via the peripheral nerves to the other parts of the body, particularly the autonomic nervous system. The involvement of salivary glands and oral mucosa is responsible for transmissibility. Therefore, we can deduce that rabies is a viral encephalitis transmitted by the saliva of certain infected mammals and bats, following a bite, scratch, or even leaking on excoriated skin or mucous membranes. Deducing after the symptoms. The patient, following the bite, presents with pain at the bite site, sometimes even paresthesias in the affected limb and area. The virus takes approximately 1 to 2 months of incubation to appear, with non-specific general signs such as fever, malaise, and headache. Then the clinical picture develops in the form of furious rabies encephalitis with very significant agitation and anxiety in most cases, thus causing psychomotor instability, including confusion, strange behavior, insomnia, and hallucinations. Also noting the presence of hypersalivation as a marked symptom in the group of autonomic nervous system disorders, in addition to cardiac rhythm abnormalities, blood pressure changes, etc. Finally, when the patient tries to drink, painful spasms of laryngeal and pharyngeal muscles, neck and diaphragm occur, which we call hydrophobia. Sometimes the clinical picture manifests as an ascending paralytic form with quadriplegia. So, faced with this picture of encephalitis or paralysis, but of course with a history revealing the notion of a bite from a suspect animal or bat, rabies is suspected. How do we confirm it then? After skin biopsy at the neck level, antibody detection by direct fluorescence of the specimen is performed. This constitutes diagnostic test of choice. The diagnosis can also be established by PCR on cerebrospinal fluid or saliva. I hope that up to now everything is clear. Otherwise, if you have questions or a part that's unclear and wasn't well explained, leave us a comment below and we'll try our best to answer you as soon as possible. The rest isn't much as we move here to treatment, where we'll only talk about supportive care, because once rabies is declared, treatment is only symptomatic, including deep sedation with ketamine and midazolam as examples, plus comfort measures. Unfortunately, death generally occurs 3 to 10 days after symptom onset. Does this mean that after the appearance of symptoms, nothing is effective or can change the prognosis, which is death? Indeed, the administration of vaccines and immunoglobulins after clinical development of rabies can lead to more rapid deterioration of the situation. Thus, the evolution of symptomatic rabies is almost always fatal and ends with death. So, does this mean that intervention before the appearance of symptoms can save a life? In short, we can say yes, it can change the prognosis. Therefore, treatment of rabies is essentially preventive. Here is the scenario for our patient who is the victim of a dog bite. Let's detail together the management approach and steps. The victim is brought to the emergency department. First step is wound care. So cleaning of all wounds with soap and water for 15 minutes. Then careful antiseptic application is performed. No suture to be performed for wounds. Only for very deep and hemorrhagic wounds can be partially sutured to stop severe bleeding only. Number 2 is post-exposure prophylaxis. This means that the goal here is to prevent the occurrence of symptoms after exposure to the suspect animal, performed rapidly after the event, which includes anti-rabies serotherapy, which is used in severe exposures. 20 international units per kilogram of immunoglobulins are infiltrated around the wound to obtain passive immunization. However, in cases where the injection volume is too large for distal regions, such as fingers, these immunoglobulins can be administered intramuscularly. This anti-rabies serotherapy is also associated with vaccine prophylaxis, consisting of 4 or 5 intramuscular injections of 1 ml vaccine in the deltoid region preferably, means in a different muscle from the one used for the injection of rabies immunoglobulins. Vaccination is distributed in the order of 1 dose on the day of exposures, means day 0, then on day 3, day 7 after, and day 14 post-exposure. The 5th dose on day 28 is reserved only for immunocompromised individuals. The procedure is generally well tolerated. Number 3 is tetanus prophylaxis. A check of antitetanus immunity is also recommended following a bite. Point number 4 is antibiotic prophylaxis. This is in cases of significant and severe wounds and injuries. Number 5 and the last one is disease notification, which is a must to report the disease as it is communicable disease. Finally, here small word about preventive treatment in pre-exposure, talking about the method of primary prevention of the disease by avoiding it, which is done mainly through preventive vaccination of domestic animals, particularly dogs and cats, measures to control wild animals in certain areas, and vaccination of high-risk populations such as veterinarians and travelers to certain regions. Cool. That's what we have as information on this topic for rabies for this video. Are you ready to test your knowledge with a little quiz? Visit our post shared on YouTube channel at the link displayed. It will help you consolidate your information. I thank you enormously for watching this video. I hope it was beneficial and informative, but of course, if questions remain in your minds, without hesitation, comment below and we'll try to answer you as soon as possible. So of course, we are committed to delivering courses and preparing videos on different diseases and syndromes. So to make sure you don't miss anything, subscribe to our channel, Dr. Medra.